So today, some tips and tricks with liner care. We frequently get questions on how to take care of our cushion or locking liners properly from patients. So the proper way to clean the liner would be to invert it where the gel side is up, like this. We're going to use non-scented soap, such as a Dawn, a Dial. It can have the antibacterial in it. The way we were going to clean this is we're going to just put a little bit over the liner like so. Scrub it in, lather it up really good, and you can use a little water on top of it as well. That way you clean the liner completely. The next thing you're going to do is just rinse the liner underneath the sink. What I usually tell patients to do is, after you get the soap rinsed off one time, shake it out a little bit and then rinse it again, just to get all the soap residue off the liner. It's recommended not to use any other kind of chemicals like rubbing alcohol or anything like that on the liners. That sometimes will degrade the liners and make them wear out sooner than the expected lifespan of the liner. The next thing you want to do is invert it back to where the cloth side is facing outward. Either put it on a drying stand that comes with the liner, like so. That way it doesn't stretch the gel out. Or you can put it just on a towel to dry out. Another key tip would be that you wash these at the end of the day when you're done using them. Let them dry the following day, and then put your other cushion liner or locking liner on the following day, since it's already been dried and cleaned. If you have any questions or concerns, please reach out to your clinician at Clark & Associates. Another good resource would be to look at our website at www.clarkpo.com.